friends! Today's video is all about that horrible symptom known as constipation. We're going to go over what are the most common root causes of constipation and how can you overcome constipation with a more natural approach. For those of you new to my channel, I'm Dr. Rajsree Nambudripad. I'm board certified in internal medicine and I also trained in gastroenterology. And I see patients every day in my practice with constipation. The great news is it's a very treatable condition. So my goal is to help you have a full and satisfying bowel movement every day because this can greatly improve your overall health. So let's dive into it. So constipation is a very common problem. It affects 20% of Americans and it only gets worse as you get older. So a third of adults over the age of 60 suffer from constipation. Constipation can present in different ways in different people. In some people, it's just infrequent bowel habits, so they have less than 3 bowel movements a week. I once had a patient who came to me and was having a bowel movement once a month. So that's extreme constipation, and we're going to come back to her case later in this video. For other people, constipation means that their stools are really hard, dry, or lumpy. And then for some people, constipation means they're straining really hard to have a bowel movement. Finally, for some people, constipation just means that they get that sensation of incomplete evacuation. Meaning, you can have a bowel movement every day, but still be constipated if it feels like it's incomplete. How many of you actually look at your stools? Well, believe it or not, it can actually give you a lot of clues to your health. What's the consistency of your stool? Do you see undigested food particles? Is there oil droplets at the top? So one way for a patient to communicate with their doctor about the consistency of their stool is to use the Bristol stool scale. So this is a way of rating your stool. Hardest stool is considered a number 1. So this is like stool that's like rocks or marbles. A number 2 is very hard and lumpy stool. So both the Bristol 1 and 2 could indicate constipation because those types of stools are really hard to pass. So my goal is to help you get your stools to a Bristol 3, which is like a sausage, or Bristol 4, which is like soft serve ice cream, because those are more easy to pass. Now what's fascinating is you can even have looser stools, like a Bristol 5, 6, or 7, but still be constipated if you get that feeling of incomplete evacuation. So some people actually have multiple bowels throughout the day, but they're still constipated because only a little bit is coming out. So the best way to know if you're constipated is based on the feeling you get after the bowel movement. A successful bowel movement should give you that full sense of relief, so that you feel clean and fully evacuated. So my goal is to help you get that amazing feeling you can get after a good bowel movement. So why is constipation even a problem? I mean, some people have a bowel movement every 3 days. So why is that a big deal? Well, that's because our stools are one of the ways our body eliminates toxins. So it's one of our biggest detox pathways. Our liver, our gallbladder, and our pancreas all dump toxins into our intestines. So if you don't evacuate your bowels on a daily basis, then the excrement is just sitting in your colon and toxins can get reabsorbed into your body. This process can increase inflammation in the body. That's why people with chronic constipation are at higher risk of a whole host of health problems, ranging from a poor immune system, to skin rashes, to migraine headaches, to cancers in general, not to mention colon cancer, and even neurodegenerative conditions like Parkinson's disease has been associated with chronic constipation. Did you know that certain hormones get recycled back into the body if you're constipated? And estrogen is one of these hormones. So women who are constipated are higher risk of developing estrogen dominance, which is when their estrogen levels are really high. I've seen women with estradiol levels over 300, which is super high. And this is usually in the setting of some constipation. So once we get their bowels moving regularly, we're able to see their estradiol levels normalize. For those of you who are not familiar with estrogen dominance, this is where high blood levels of estrogen can cause symptoms like weight gain, breast cysts, fibroid tumors, PMS, heavy periods, and painful periods. Next, constipation can really affect your energy and your mood, because when you're backed up, you just feel lousy and gross. Now, did you know that your gut is considered the second brain? You actually make 90% of your serotonin, which is that happy brain neurotransmitter, in the lining of your gut. So that's why if you're constipated and your gut is inflamed, you're not going to be able to make as much serotonin and dopamine, which is the other happy brain neurotransmitter. So that's why chronic constipation can impact the production of these brain neurotransmitters and contribute to depression as well as anxiety. Next, chronic constipation can cause structural problems. One of the most common ones is hemorrhoids. So hemorrhoids are basically dilated blood vessels that are swelling up in your rectum due to all the pressure from the stool. And these can be a problem because they can bleed and cause a lot of pain. So the best way to fix your hemorrhoids is to fix the constipation. Some people go to a colorectal surgeon to get their hemorrhoids removed. But unless you fix the constipation, the hemorrhoids can come right back. Next, chronic constipation can cause diverticulosis. So this is when the pressure in the sigmoid colon causes weakening of the wall so that it develops little outpouches. We call this diverticula. The problem is these little outpouches can get infected, just like the appendix can get infected. So we call that diverticulitis. So if you've been told you have diverticulosis based on a colonoscopy or a CT scan, the best way to prevent it from getting worse is to address the underlying constipation. So most of us have experienced constipation at some point in our lives, either due to travel or due to changes in the diet. But if constipation persists for over 6 months, we call this chronic constipation. Now let's get into what are the root causes of constipation. So constipation can be primary or secondary. Primary constipation is caused by problems in the colon itself. So either the muscles or the nerves are not working properly. So this can be labeled as primary idiopathic constipation or slow transit constipation. Secondary constipation is caused by something else. So most of the time we're dealing with secondary constipation. So one of the most common causes of constipation in the United States is the standard American diet, also known as the SAD diet. For example, if you're eating a donut for breakfast, burger and fries for lunch, and some takeout tacos for dinner, you're probably barely hitting 10 grams of fiber. And fiber is needed to bulk up the stools. So diet is a big cause of constipation. Another big cause of constipation is being sedentary. So movement and exercise is so important for the motility of your gut. And exercise also promotes the growth of healthy bacteria in your gut microbiome. So unfortunately, people who are sedentary are at higher risk of constipation. Next, we have dehydration. So are you drinking enough water throughout the day? Or maybe you're drinking too many caffeinated beverages, like multiple cups of coffee a day or multiple glasses of iced tea. Because caffeinated beverages actually cause you to lose more water. So when you're dehydrated, your body compensates by taking the water out of your stool as it's passing through the colon. So this causes the stool to become really hard and difficult to pass, which is constipation. Next, we have hypothyroidism. So if you have a sluggish thyroid, that affects the motility in the gut. So it's good to have your doctor run a full thyroid panel to rule out hypothyroidism. Next, we have diabetes. So if you have uncontrolled blood sugars, this can impact the motility of the gut and lead to constipation. Pregnancy can obviously lead to constipation because high levels of progesterone can slow motility in the gut. If you have an autoimmune disease, like a connective tissue disorder such as scleroderma, this can impact the motility throughout the GI tract and can cause constipation. Next, we have medications and supplements. Among medications, narcotic pain medications and opioids can cause constipation. That's why a lot of times people get constipated when they're recovering from surgery because they're sedentary and they're taking pain medications. Among supplements, synthetic iron pills can sometimes cause constipation, and calcium supplements can also cause constipation. So that's why I like to balance iron and calcium with magnesium. We're going to talk a lot about magnesium today, but magnesium is wonderful for moving the bowels. Next, we have food sensitivities. Some people notice when they eat gluten or dairy, boom, they're constipated. For example, if they have a pizza, they'll be backed up. So gluten sensitivity is on the rise. So the best way to figure out if you have this problem is to avoid gluten and dairy for at least 2 weeks and observe if your bowels improve. Another cause of secondary constipation is hyperparathyroidism. So the parathyroid glands are tiny glands that sit behind your thyroid in your neck. And if they're producing too much hormones, your blood calcium levels goes up, and that can slow motility in your colon, leading to constipation. Next, we have intestinal methane overgrowth. So this is caused by a species called archaea, and they can be located in your small intestine or colon, and they convert hydrogen gas into methane. The problem is methane gas, for whatever reason, slows the motility in your bowels. If the archaea are located primarily in your small intestine, they can cause a lot of bloating, and we call this small intestine bacterial overgrowth caused by methane-producing archaea. But now we know these archaea can be also located in the colon, and that's why the terminology has been changed to intestinal methane overgrowth. Intestinal methane overgrowth is a tough condition because it can create this vicious cycle where the constipation is causing the overgrowth of these archaea, and these archaea are producing methane, which is making the constipation worse. The good news is it is a very treatable condition. I have a whole video dedicated to SIBO where you can learn about treating the methane variety of SIBO, and I'm going to link that below. Next, we have irritable bowel syndrome, constipation predominant, also known as IBS-C. But IBS is actually just a label for the symptoms, so it doesn't tell us what's causing the symptoms. And in 70% of cases, it's often caused by SIBO, specifically the methane variety, also known as the intestinal methane overgrowth. Another cause of constipation is dysbiosis. So dysbiosis means there's an overgrowth of a bacteria or a fungus like Candida. A lot of times this can be caused by antibiotics. So a lot of patients will tell me that after a round of antibiotics, their gut just wasn't the same. Now they have constipation. That's because antibiotics can change your microbiome. The reason the bacteria in your gut matter so much is that our stool is not simply the excrement of the food that we're eating. It's actually byproducts made by the trillions of bacteria in our gut microbiome. That's why healing the gut microbiome is a big part of treating constipation. Next, we have chronic stress. So if you're constantly in a state of fight or flight, your sympathetic nervous system is going to be on overdrive, and it's going to suppress your parasympathetic nervous system, which is your vagus nerve. So normally your vagus nerve promotes motility in the gut. So if you're suppressing your parasympathetic nervous system due to all that stress, it can cause constipation. Chronic stress can also raise your cortisol levels, and that can change the bacteria that grow in your microbiome, also leading to constipation. Next, we have circadian rhythm dysfunction. So if you travel a lot internationally and your sleep is disrupted, or if you're a night shift worker, this affects your circadian rhythm, and that can also impact the motility in your gut, leading to constipation. Another cause of secondary constipation is pelvic floor dysfunction. This sometimes happens after childbirth, where the pelvic floor muscles get traumatized, so then they don't relax properly, making it hard for the stool to get expelled. The good news is it's a treatable condition with pelvic floor physical therapy. Finally, there's a condition called dyssynergic defecation, and this is caused by impaired coordination between the rectoanal and pelvic floor muscles, making it difficult to properly expel the stool. Again, this is treatable with pelvic floor physical therapy and biofeedback. So how can we treat constipation more naturally? I mean, nobody wants to end up on prescription medications for constipation, and no one wants to take over-the-counter laxatives long-term. So usually, most doctors will tell you to increase your fiber intake, both in your diet and through supplements. But interestingly, that is not how I treat my patients. Because what I've learned is that universally, most people who are constipated also have a lot of bloating and abdominal discomfort. So if we increase fiber initially, that actually worsens their bloating and discomfort and can worsen their symptoms and make them feel miserable. So first, I like to unclog the drain, meaning let's get the bowels moving first. This is going to help really alleviate your bloating so that you feel better, and then we can start ramping up the fiber. So the first thing I like to do to help my patients with constipation is to use 3 things. And I found that these 3 things work incredibly well for the vast majority of my patients. The first thing I like to use is magnesium. So we use a chelated magnesium called essential magnesium. And this magnesium is a combination of magnesium glycinate, citrate, and malate. So it's gentle on the bowels, and it works as an osmotic laxative, What that means is it gently pulls water into the colon through the process of osmosis. So I'll typically have patients take anywhere from 2 to 4 capsules at bedtime. So that's anywhere from 250 to 500 milligrams at bedtime. And the great news is magnesium is safe to use long term. It doesn't create any dependency in the colon, so it doesn't cause a lazy colon. And most people are deficient in magnesium, so it can also help you get a deep sleep. It helps with muscle recovery, anxiety. It can help with your blood pressure. It's also great for preventing migraine headaches and for preventing PMS. We often refer to magnesium as the miracle mineral because it does so many amazing things in the body, and it definitely helps to move your bowels. The second thing I like to use is motility activator. So this is a special ginger formula that's really gentle on the gut. It doesn't cause any ginger burn, and what it does is it helps to naturally promote the motility in your gut. So if you take this at bedtime, it's going to help promote those waves of peristalsis through your small intestine as you're sleeping. So it's actually not a laxative, it's just a natural prokinetic. So it helps to activate your MMC, which is the migrating motor complex, which controls the waves of peristalsis throughout your intestines. So it really helps to alleviate all that bloating and discomfort that's often associated with constipation. The third thing I like to use is a strong digestive enzyme. So we use Digestive Enzyme Pro. Because remember, most people with constipation have a lot of bloating. So what enzymes do is they help to break down the food so that you can absorb the nutrients better. So it really helps with bloating. It can also help to break down biofilms. So biofilms are created by bad bacteria to hide from your immune system. So enzymes can help to get rid of those bad bacteria and reduce inflammation in your body. What I love about Digestive Enzyme Pro is it targets proteins, fats, and carbohydrates. So it has ox bile and pancreatin to target fats, it has betaine and pepsin to target proteins, and it has bromelain from pineapple to target carbs, as well as papain from papaya to target carbohydrates. So I've found that this protocol of these three things, which is the essential magnesium, motility activator, and Digestive Enzyme Pro, can make a night and day difference in bloating and bowel movements. And the great news is you don't have to really do any testing on your microbiome before starting these things. So I'll typically have my patients start this at their initial consultation so that they can start feeling better. I also remind my patients not to snack between meals. So you only want to eat 2 or 3 meals a day. That's because in between meals is when your migrating motor complex, which is those waves of peristalsis, is able to clean out your small intestine. So this can make a huge difference if you're having bloating. So if you have a little bit of small intestine bacterial overgrowth or SIBO going on, just by cutting out the snacking and taking these 3 things, you can feel significantly better. Of course, I always ask my patients to clean up their diet. So that means cutting out all the processed foods and refined sugar and eating more whole foods. Sometimes I'll ask them to do a trial off of gluten and dairy to see if they feel better. And often they see significant improvements. So they start losing weight, they feel less inflammation, they're less bloated. They'll sometimes even notice other things like less joint pain, their skin starts clearing up, they have less migraine headaches, and then typically their bowels will also start moving better. So what if you're taking the magnesium regularly, but you're still not having a bowel movement every day? Well, then you can try adding something called Aloe Pro. So this is the dried leaves of the aloe vera plant in capsule form. And when you take this at bedtime along with your magnesium, it helps activate contractions in the colon. So it's a natural, gentle stimulant laxative to get your bowels moving. Now let's talk about probiotics. Now remember, dysbiosis and bacterial imbalance can be a big part of gut inflammation and constipation. So to get the microbiome healthier, I like to use probiotics. So 2 of the most popular ones in my office are the probiotic 100 billion and the probiotic 225 billion. And these both have several strains of lactobacillus and bifidobacterium. And research shows that these strains of bacteria improve bowel frequency and make the stool softer. So I'll typically have patients take this first thing in the morning on an empty stomach. But if you're suffering from IBS symptoms, there's one more probiotic to be aware of, and that is Saccharomyces boulardii, also known as S. boulardii. So it's actually a probiotic yeast. And research shows that it's actually really helpful for IBS symptoms, discomfort, it promotes bowel regularity, and it also helps to push out other bad yeast from your body. So if there's any bad yeast growing in your microbiome, like Candida, it can help to push those out. Or if you have outward symptoms of yeast overgrowth, like dandruff, thrush, or vaginal yeast, S. boulardii can be really helpful. Now that we've gotten your bowels moving, we can finally add in fiber. So there's so many different fibers to choose from. There's psyllium husk, there's acacia, and in my practice, we like to use prebiotic fiber. This is made from a green banana flower, so it's a resistant starch, and it also has larch arabinogalactans from the larch tree. So this is a great prebiotic fiber that helps to bulk up the stool and improve the softness of the stool. So this prebiotic fiber is really good for promoting the growth of good bacteria in your microbiome. So you want to start slow and gradually titrate up the dose so that you don't experience any bloating or discomfort. So I recommend start with a half a scoop a day and work your way up to 2 scoops a day. The other great thing about this prebiotic fiber is it's a resistant starch, so it helps to improve your satiety and keep you full. So it can be really great for those who are looking to lose weight or improve their insulin resistance, prediabetes, or diabetes. So we've covered probiotics and we've covered prebiotics. Now let's talk about postbiotics. So postbiotics are the end product when the bacteria in your gut metabolize the food that you eat. So butyrate is one of the most important postbiotics in your gut, and it actually is food for the cells lining your colon. And butyrate is known to help promote motility in the colon, reduce inflammation, and can also reduce the risk of colon cancer. Finally, I often use some natural herbs to help clean up the dysbiosis and bad bacteria in the microbiome. So 2 of the most popular ones that I use are oregano oil and berberine pro. Because what I've learned is that the majority of the time when I do a microbiome test for my patients, any bad bacteria will be sensitive to these 2 herbs. And these 2 herbs are typically very well tolerated. They also help to break up biofilms, which are those coatings on the bad bacteria that often make them resistant to treatment. What's also great is that berberine and oregano, they also work for fungal overgrowth like Candida. So they work for both bacterial dysbiosis and fungal overgrowth. And so I'll typically have patients take these twice a day after food for about 1 to 2 months. And it can make a huge difference in their discomfort, abdominal pain, bloating, and constipation. Over the years, I've seen tremendous success in cleaning up an unhealthy microbiome with these 2 herbs, berberine and oregano. Now let's talk about the diet. Once you're having a bowel movement regularly and you're feeling good, now's the time to start ramping up fiber in your diet. Because remember, fiber bulks up the stool and makes it softer and easier to pass. The best way to get fiber in your diet is to eat lots of vegetables and fruit. Because these not only have fiber, they also have phytonutrients and antioxidants. They're good for your gut microbiome. They also reduce inflammation in your body. So these help to really reverse disease processes and keep you healthy. So I'll often tell my patients to aim for 1 pound of vegetables a day. Now I know that sounds like a lot, but it's actually very doable. So that's 16 ounces. So if you make that effort to have vegetables at every meal, you can get to 1 pound. Next, we have nuts and seeds. For example, you can use chia seeds. Chia is great because it soaks up water, so you can use it to bulk up your stool. So some people like to make chia seed pudding, which tastes delicious. You can also use flax seeds. Either whole flax or ground flax, and sprinkle that on your food or use it to bake some paleo muffins. You can also use sunflower seeds and pumpkin seeds in your salads. Nuts are also a great source of fiber, so there's so many to choose from. Some people like almonds or pistachios or pecans, so choose whatever you enjoy. Next, we have legumes, which are lentils and beans. The problem is that a lot of people don't digest these well and they suffer from gas and bloating. So a lot of my patients with IBS do better when they avoid lentils and beans. Part of the reason is these legumes have resistant starches that are hard to break down. So then they feed bacteria that produce gas. The other issue is the outer coating of a bean has something called lectins. So lectins are like the defense mechanism of the plant. So if you think about a bean, it doesn't really want to get digested. It wants to travel through your intestines and become a plant somewhere. So because of that defensive outer coating, for some people this triggers abdominal pain and inflammation in the gut. Another source of fiber is whole grains like oatmeal, brown rice, or quinoa. However, I only recommend eating whole grains if you're not struggling with your weight or you don't have diabetes or insulin resistance, because otherwise, whole grains can increase insulin release. They're also problematic if you have fatty liver disease. So seeds, whole grains, nuts, and legumes, they all have some lectins. So if you really enjoy these foods, you could try soaking them first or cooking them with a pressure cooker. Sometimes that makes it more digestible. Or take a digestive enzyme to help break things down. One of the most popular diets that I recommend to my patients is the paleo diet, and it works great for IBS as well as autoimmune disease. So the paleo diet is grain-free, so it's typically lower in lectins. It also takes away dairy, gluten, and legumes, which are big triggers for IBS in a lot of patients. People typically feel less bloated on a paleo diet, and because they're eating less carbs, they lose weight, they feel less inflamed, and we see improvement in their blood sugar and insulin levels. So I've seen a lot of success in reversing disease with a paleo diet, which is also sometimes known as a Whole30 diet. Now let's talk about water. How much water should you be drinking per day? Well, you can calculate this by taking your body weight in pounds and divide by 2. So if you weigh 200 pounds, you should be drinking 100 ounces of water per day. Now, caffeinated beverages don't count, because when you drink 1 cup of coffee, you actually urinate out 2 cups of water. So you actually lose water. So you need to drink more water to make up for caffeinated beverages. Now, if you don't enjoy drinking plain water, try adding some electrolyte powder. So the electrolytes have all the minerals to give your cells energy, and it also tastes good, so you end up drinking more. Now let's talk about fermented foods. So this includes like sauerkraut, kimchi, pickled vegetables, and non-dairy yogurt. And these are a great source of natural probiotics that can improve the diversity of your gut microbiome. But if you eat these foods and feel worse, then you may be histamine intolerant. So I'll try to cover histamine intolerance in another video, but typically it's an indication that there's something going on in your gut microbiome that's not allowing you to break down histamines. So you're getting symptoms like headaches, rashes, insomnia, or nasal allergies. So it's good to be aware that fermented foods, although they're healthy for some people, they're very high in histamines. What about exercise? Well, exercise is super important for the motility in your gut. So by doing some cardiovascular exercise, you're actually going to promote the MMC, which is that migrating motor complex, promoting the waves of peristalsis through your small intestine and your colon. So choose an exercise you enjoy, whether it's brisk walking, running, cycling, hiking, or swimming, and try to do about 30 minutes every day. What's fascinating is research actually shows that cardiovascular exercise actually promotes the growth of good bacteria in your gut microbiome. So exercise does 2 things for your gut. It promotes the motility and it enhances the growth of good bacteria. Next, it's also really important to have a regular sleep schedule, because having a healthy circadian rhythm can influence the motility in your gut. It's also important that you create a regular bowel schedule. So most people want to have their bowel movement first thing in the morning before they go to work. So what I recommend is take your magnesium and motility activator at bedtime. Then when you wake up, drink a nice big glass of water. If you enjoy coffee, go ahead and have 1 cup, because coffee actually activates the gastrocolic reflex. So it helps get your colon moving. Just keep in mind that you want to avoid drinking multiple cups of coffee throughout the day, because that can cause dehydration, which can make constipation worse. Now I know a lot of you are just watching my video at home, but when should you seek a doctor's attention? Well, these are some things to look for. If you're noticing blood in your stools, if you're losing weight, if you're having nausea or vomiting, if you're just not getting better with over-the-counter treatments. If you're age 50, you want to see your doctor because you're due for a colonoscopy. So that's a procedure to screen for colon cancer. And the other great thing is if they find any precancerous polyps, they can remove them. and a lot of these polyps could potentially turn into cancer 5 to 10 years later. Finally, if you have persistent bloating that's not getting better, you'll want to see your doctor or gastroenterologist to get a SIBO breath test. To learn more about SIBO, which is a big root cause of bloating, I'm going to link my video below which covers this in great detail. Now let's return to that patient I mentioned at the beginning of the video who was only having a bowel movement once a month. When I first met her, I was astonished to hear that. But I just walked her through this protocol step by step, and I had her clean up her diet. And what was amazing, when I met her 3 months later, she was having a bowel movement every day, and it completely transformed her life. She lost 20 pounds by cleaning up her diet. She was no longer bloated. She had so much more energy, no more migraine headaches. She also noticed that her skin completely cleared up. She used to have acne and redness on her face, and now her skin was glowing. So this really shows how amazing healing the gut microbiome is and what an impact it can have on your overall health. I get a lot of inquiries from people all over the country who are looking to schedule appointments with me. But unfortunately, my practice is now at full capacity, so I'm not able to schedule any new patients. So my hope is that these educational videos can help people, and also we offer all of these supplements that I talked about today on my supplement store. So I have a whole section dedicated to the gut microbiome where you can learn all about the things I described today in more detail, how best to take them, and we do ship throughout the United States. Now I want to share a little story. The other day I received an email from a gentleman who I'd never met, but who was ordering supplements from my store for a couple months. And he wrote to me saying that he followed my protocol for SIBO based on my video and based on the tips on my supplement store and got significantly better. And it really improved his quality of life. And prior to that, he mentioned he had seen a gastroenterologist but wasn't really getting better with the conventional treatments. So it was just so wonderful hearing and knowing that these educational videos and supplements are able to have a positive impact in people's lives. Now I want to hear from you. Have you suffered from constipation? What helped? Did fiber make it better or worse? Please share your story by leaving a comment below. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up, subscribe to my channel, and don't forget to share it with your friends. I hope you have a wonderful day, and I'll see you next time.